The speaker of the second presentation is Madam Anita Abu Bakar, and the title of her presentation, The Role of Social Media in Reducing Mental Health Stigma and Discrimination, Experiences from Malaysian NGO. Madam Anita is the founder and president of the Mental Illness Awareness and Support Association, Miyaza. It is a mental health advocacy and peer support group based in Petaling Jaya, Malaysia. Being a peer herself, Madam Anita is an advocate in promoting awareness on mental health. She has been a guest speaker and panelist in many conferences and programs. Madam Anita has also spoken at many universities, corporations, and government agencies across Malaysia. She has conducted various programs and initiated much effort to educate the public on both the importance of mental health and addressing the many misconceptions and myths in hopes of reducing the society's stigma and inducing the availability of more support for those struggling with psychological symptoms. Please welcome Madam Anita, and Madam Anita, you may begin your presentation.
Bismillahirrahmanirrahim. Assalamualaikum and a very good morning, everyone. Today I will be presenting on the role of social media in reducing mental health stigma and discrimination. Before I begin, I would like to congratulate the whole organizing committee for the 22nd NIH Scientific Conference organized by National Institutes of Health and also Asia Pacific Academic Consortium for Public Health. Thank you so much for the opportunity today. So just a little bit before we begin, due to the whole pandemic hit, obviously we have changed the way we do things currently, especially being mental health NGOs on the ground. We are definitely the closest people to the community, and when the whole pandemic hit happened, we migrated all our services online. We learned a different way of doing things. And so I would like to share a little bit about the strategy on how everything came about and the importance and the strength of social media and digital media, of course, in reducing stigma, in normalizing this discussion very much. And this is what truly we have seen on the ground. Alhamdulillah, very, very happy and very thankful for this. Really quickly, I just wanted to introduce a little bit about Miyaza so that you guys understand the perspective, the views on what I will be sharing today. Peer support changes lives. And so Miyaza, we are a mental health advocacy and peer support group. And of course, it is evidence-based where peer support makes a huge difference on various aspects. So in terms of increasing self-esteem, when you sit in a group, you are among people that are going through something similar to you. It really helps in bringing that sense of camaraderie where you feel empowered, you feel that there is a sense of hope and that there is a way out, and there's a lot of empathy and compassion and no judgment in that sense. And of course, what is really interesting is it also decreases psychotic symptoms, it reduces hospital admission rates and longer community tenure, and it really decreases the reliance on an individual on substance abuse, be it alcohol or drugs. So being Miyaza, we started officially actually in 2016. We are the first peer group in Malaysia. So we are it's initiated by a peer, and it is run, the activities and programs are also run by peers. And the majority of us in Miyaza are people with lived experience. A huge bulk are peers, and the balance are caregivers and also mental health advocates from various and diverse backgrounds. So the strength of Miyaza is basically we provide non-medical alternatives to mental health, and we look at the whole life approach. So this includes, spiritual therapy. We've got art therapy, expressive dance therapy. We do provide supported employment programs, job placement. We encourage as much as possible for other peers to volunteer, become spokesperson of Miyaza. And of course, we provide as well mental health assessment, circle time, circle of care, peer support group, and also family support group discussions, amongst others, of course. And we are also the first to provide a holistic solution to recovery where it is translated to services. So as much as possible, Miyaza, we act as a one-stop center. We also champion very much the recovery model and also human rights-based approach. Although we always say there is no health without mental health, but really there is no mental health without human rights. And also we look at the person where it is not an absence of symptoms, but we as a person with the condition, we are beyond our symptoms. We are more than our symptoms. So no matter what mental health disorder or mental health condition a person has, they can recover. And this is where we guide, support, and help so that the person can grow beyond whatever that they are struggling with. And we also provide free essential services to the B40 group to break that barrier to access. And also we provide basic necessities for those in need. We very much advocate for zero coercion practices and full inclusion of people with mental health disorders and people with disabilities. We also run the first peer-based crisis management center and activity center in Malaysia, which we launched last year. And also the first supported program, supported employment program from a peer approach. And we also, we don't limit ourselves in Malaysia, so we also do a lot of international advocacy where we belong to TCI Global, a global movement currently with 140 members across the globe. We also have a crisis helpline, and what is different or unique about our crisis team is actually not only do we operate 7 days a week, but we are able to mobilize our volunteers nationwide. So we are able to go to the person in crisis. And this year we have initiated the National Alliance of Mental Health, which consists of various stakeholders from mental health NGOs from the ground, our various friends from the other disability groups, higher learning institutions, social enterprises, and more. So just a little bit, we are very much focused on awareness, advocacy, relief support, and also livelihood support. So really, really quickly, I just wanted to share on the strategy and the reason why we migrated our services online early last year when the pandemic happened. So we weren't able to operate because we were not, part of essential services. Everyone was scrambling. Obviously, coronavirus was something new. Nobody understood it. We didn't understand what was happening. So there was a lot of confusion during the time. And so what happened was, and what we've learned from, the lessons of COVID-19 when it happened last year was obviously the neglect and underinvestment in mental health services. And I think it was really, extraordinary that last year WHO came out with, World Federation of Mental Health came out with the theme for World Mental Health Day being mental health for all, greater investment, greater access, really encouraging and providing awareness on how it is underinvested, the area of mental health. And of course, there was a lot of fear, people going through anxiety, a lot of uncertainties, people falling into depression. And I think, the irony of the whole thing, this isn't something new because we've seen this throughout human history via epidemics, pandemics, war, famine, Great Depression, for example, where when things like this happen, people do fall into anxiety, depression, suicide risk increase, people resort to harmful coping mechanisms, etc. And so we've seen how it was difficult and challenging for newly diagnosed peers to access help, and existing patients or peers were not able to access the help in the beginning as well. So because of this was how we went through that quantum leap of migrating, all our services online and learned how to do, all our programs, activities, campaigns online as well, and truly understand the strength of social media. And so one of the things that we saw a lot was the heightened risk of relapse, recurrence of episodes, deteriorating of health, and obviously, challenging in terms of accessing mental health services, which was already a challenge in the beginning, more so when the pandemic happened. And of course, the first MCO, the lockdown was really brutal for everyone. So, being cut off from the real world, from your social support system, from effective coping mechanisms, a lot of people working from home, students studying online, etc. So everyone was scrambling during the time, and so were we. So what happened was we realized during the time that we needed to have a strong online presence to adapt to the current situation, although we already, to be honest, had quite a strong presence already. But we learned further. We tried to understand the whole, social media world altogether. And as we know, there's various types of social media with the different demographics, and we try to, as much as possible, use the more popular ones to really engage with those that feel isolated, that those that are very much need help, and wouldn't feel that they're being left behind in that sense. So we really used Facebook, YouTube, WhatsApp, Instagram, TikTok, and as we know, there are 3.8 billion social media users globally. And so we've seen how doing this and also migrating our services online had the potential to really improve accessibility, outreach, awareness, advocacy, and also because of the affordability of the services. So we were able to really cater to the influx of all these people reaching out for the help, obviously, without compromising the quality of our services. And so just to give you a little bit of overview on how we did it. So these are the breakdown of the digital platforms used for services, awareness, support, and advocacy. So we've got our Miyaza services via WhatsApp, Google Meet, and Zoom, and social media, as mentioned, Facebook, YouTube, Instagram, Twitter, and TikTok, and also our web and app-based tool. So we very much cover as much as possible, trying to reach out, engage, and interact with, every possible demographic, people on the ground, people in the community. And so for Miyaza services, which obviously there's a whole range of services, really using WhatsApp, Google Meet, and also Zoom for this. And again, we never used Google Meet and Zoom, prior to the pandemic hit. So this was a big learning curve for us as well. And I think we all can relate where in the beginning, Wi-Fi connectivity was also a problem. It was also a challenge. Now it's better, much better, improved, of course. And so it's easier today. So these are some of our services. So again, we migrated all our services online. Really everything that we can possibly do online, we have migrated it. Our crisis team, definitely, we use Google Meet and also via phone call and WhatsApp. And we are this month expanding our crisis team, where we will be running it 24/7, 24 hours a day, 7 days a week. Currently, it is 7 days a week, but only 12 hours a day. Okay, so when we talk about social media, what do we use it for? Infographics, our campaigns, fundraising, our talks, forums, roundtable discussions, surveys, and also meetings. And what happened was, when we first, came into the whole mental health scene, we realized that there was a big gap in mental health literacy. A lot of people didn't really, know about mental health, what more mental health disorders. Stigma is so widespread, which of course leads to discrimination. And that was how we launched our first campaign, which was called Miyaza Reach Out Campaign 2018, where we provided infographics. We fed information to the public every single month, having different themes altogether. And from there, we learned how to do many campaigns, and our campaigns still today have had massive and overwhelming response from the public, because a lot of our campaigns are done in a way where we empower the public, we engage with the public so that they are able to have a voice, especially those that are silenced via stigma. So we've got Miyaza Stay Connected, where it's an outreach initiative. We did a lot of different postings, even live sessions, be it art, be it exercising, information, forums. Unlock Your Story is where we reach out to the community. Those that are struggling with mental health disorders are able to share their story via audio, video, and also text narration. We, till today, we still continue to receive, massive amounts of stories, and we are compiling it to become an ebook as well, hopefully launching it during World Mental Health Day. Zero Coercion is a campaign where we aim to shed light on coercive practices, although we know there are limitations of various things here in Malaysia, but hopefully to bring this discussion out in the open so that we can expand community mental health services and think of alternative ways in implementing good practices in Malaysia, like how many other countries have migrated to for a very long time. So these are just some of the different campaigns that we have run. Rise for Mental Health was one that we engaged the community. We, they came in, contributed via singing, dance, their stories, and we did it concurrently with a fundraising event. So Rise for Mental Health, we were able to raise about 50,000+ ringgit, guys. So alhamdulillah, very happy with all the campaigns that we've been running. And these are some of the infographics that we've done throughout some of our different campaigns. Be the change, again, empowering the community, and hundreds of responses as usual. Stigma Watch. This is really a way to destigmatize, to also empower the community to be more observant, mindful when we say things, the language that we use, how we act, behave, as a way to decrease stigma, and also the intention of those that have been stigmatized and discriminated to come out in the open, feeling braver to share so that something can be done about it. Awareness programs, tons during the MCO. Just to share with you a little bit on the outcomes. This was actually a collaboration with the Selangor government. Total view 346,000 via 3 months program. Total reach of more than 800,000. Just some of the different episodes that were done. The second time we ran it, we only did it for 8 episodes just to finish up the year. It was done in December. Total view of 17.8K and total reach of 47,000. And this is really something that we never knew before. It was never explored, because when we do physical sessions, usually it's a couple of hundred people, maximum 1,000. So now we realize doing it, online, there's a lot of, reach. We're able to reach a lot of people, and even all our programs, we do measure our impact, and the impact measures has been great. A lot of people from the surveys have shown that they have an improved understanding of mental health, although obviously the challenge is always whether the change in perception does make a change into, or translate it to a change of behavior or not. And of course, web and app-based tools. There's a couple that we're doing right now. And if you look at our website, if we compare it 2017, 18, 19 to today, we're looking at, even via our website, hits about 175,000 last year. And this year till August, about 134,000. So different apps that we're currently collaborating with. Selangka Sihat is under the Selangor government. So we man the forum sessions under this app, where we talk to the Selangor people on, mental health challenges, caregivers that need help, for example. And also Nino Buddy, where it is a what we call as a Uberized healthcare solution, like how you would order food via Grab and Uber before. This is actually booking for a Nino buddy, someone that can accompany you, a peer that can accompany another peer at home. For example, if you need someone to talk to, if you need someone to accompany you to see a doctor, etc., etc. So we have been using all these technology to really reach out to the various groups, the vulnerable groups especially. And we are currently in the middle of building our pilot app, Miyaza app, which we're really looking forward to coming out really soon, guys. So just really quickly sharing our Miyaza communication log. Instagram, we have about 38,000 followers. Facebook, 18,000. Not really big on Twitter. We're still learning, about 3,000. And also we have a program on IKIM FM, which ran for about 2+ years with a following of about 250,000. So just to give you an overview really quickly on why mental health NGOs on the ground are really stretched very thin. From August last year after our MCO till August this year, 96,000 people have reached out to Miyaza via calls, WhatsApp messages, social media, emails, face-to-face, and mostly virtual sessions, because we are currently closed at the moment as well. So can you imagine how the health system is overburdened, the mental health system is also overburdened, but hopefully with NGOs on the ground, we are able to ease that burden of the health system as a whole. Just to give you a quick overview, activities during the pandemic hit 207, total activities throughout our years since inception doing this work, 530, overall impact during MCO 1.565 million, which would have never happened if the pandemic did not happen. So in line with WHO's digital health strategy, this is really what we're trying to do. So we commit, catalyze, we measure every single thing that we do, and hopefully to be able to improve via the feedbacks that are given to us as well. So this is just an example of some other programs, digital health, that are done overseas. Side by side is also, their strength is also in peer support. And of course, we have 7 Cups of Tea is a website which provides online therapy and free support to people that are going through emotional distress, as a whole. So these are just different types of programs that we've done. And just to wrap it up, this is the strength and limitations that we've seen from the work that we've done. Obviously, better geographical reach, increased accessibility, and online mental healthcare obviously is more covert. People, they feel more comfortable to reach out online. What we've seen, of course, more affordable. But of course, in terms of limitations, less actual engagements. There's a lot of glitches. Sometimes a lot more in the beginning, very much improved right now. Not accessible to those that are not very savvy in technology, for example, and we're not really able to look at body language as much as a physical session. And of course, there's also sometimes fear of information leaks and breaches. But moving forward, what we've seen, if we assess all the things that we've done online, we really feel that it is very beneficial when you consider the potential outreach, the ease and affordability. We're able to break that access to information, break that access to services, and especially because at Miyaza, our services are free for the B40s. So that's really helpful. And we've been able to engage and empower the community because of, all the different campaigns that we've done. So we are currently witnessing an increase in help-seeking behavior, people reaching out, improved mental health literacy, and of course reduction in stigma. Very, very happy to be seeing this. People are braver more, people feel more encouraged, and the normalization of mental health and mental health disorders is happening. And really, we're going through no longer a silent mental health pandemic wave. We're really seeing it at the moment, and we need to act fast. And so it has really encouraged us to be more creative with our programs, raise awareness on a really large scale, and at the same time acknowledging the limitations and downsides of it, and do the best that we can with the limitations, of course. But we believe that this challenges obviously has motivated us to innovate and mitigate whatever limitations out there. Thank you so much, everyone. And again, as usual, before I end, a message of hope for everyone. You're not alone. For those of you that are struggling, you can recover, and there is always hope and a way out. Thank you very much, everyone, for listening. Together, let's build back better. Thank you.
Thank you very much, Madam Anita, for her excellent presentation and sharing her experience from Malaysian NGOs' perspective on the role of social media in reducing mental health stigma and discrimination.